I'm Jessica and I'll be your medical assistant today. And today I'll be explaining how to proceed an intradermal, which is the ID for abbreviation. And this is going to be located in the forearm, in the middle, in the intradermis, which is at the very top layer of the skin. So first off, I'm going to show you my equipment. So I do have the vial. I have a bandage. I have gloves, alcohol prep wipes, gauze or cotton balls, and the needle and the right gauge size. Okay, so first off, I want to make sure I have the right patient. I want to make sure I have the right drug. I want to make sure I have the right route, the right dose, and the right time of administration. And my patient does always have the right to refuse. So you always want to make sure you wash your hands when dealing with the patient, before and after doing anything with the patient. So I'm going to make sure I have my right medication that the doctor has ordered. So I'm going to look at my paperwork. And okay, so I'm gonna look at the lot number and the expiration date, and everything looks good so far. I'm going to be using a 27 gauge times 1.5 needle, and this is going to be inserted at a 10 degree. So first off, I'm going to prep my medication, and I'm going to make sure I take out, I'm going to make sure the needle's on tightly. And then after that, I'm going to pump out some air a few times. I'm going to look at where my dose is going to be. Okay. And then I'm going to make sure this is clean. I'm going to wipe it with alcohol prep wipe, and then make sure it dries first completely. And then I'm going to insert it, flip it, get my dose, my right dose. There might be some air bubbles, so you want to flick those out. You have to flick out all the air bubbles. And as soon as you do that, you could prep your patient by using an alcohol prep wipe. I'm going to use my 2 hands to measure where it's going. So it's going to be right here, and then right here. And then I'm going to go at the middle, make sure there's no veins, no scar tissues or anything right there. So I'm going to use alcohol prep wipe. I'm going to clean it outward and then let that dry on its own for about 60 seconds. And then I'm going to get my needle, and I'm going to go in at the top of the layer at a 10 degree angle, and I'm going to insert it at the intradermis, and it's going to create a wheal, which is like a little blob or a little bubble. So after that, you don't want to clean it. You put the needle in the sharps container, and then you don't want to clean it. You don't have to put a bandage on it, because you will come back to the doctor's office in a couple of days, so the doctor can check it. And you don't clean it, you don't touch it or anything. And